Hi friends, welcome to my channel Dr. Ghosh Presents. I am the creator of the channel Dr. Surjit Ghosh. I am speaking to you from Kolkata, India. We are going to start a new episode. I would request you to please follow this attentively.
Today's discourse: Polycystic Ovarian Syndrome (PCOS). Title: Menses of daughter irregular, very fat, acne, extra hair on the face, maybe PCOS. Please take care. In the discussion, we refer to polycystic ovarian syndrome as PCOS. Some physician once remarked, PCOS is a multi-headed Hydra. That he was absolutely correct would be understood by you at the end of this video. The first damage which the disease causes to a daughter requires immediate care. The disease makes a lady incapable of conception on the first hand. That's why she requires immediate care. Before knowing PCOS, let us have a first-hand knowledge of the female reproductive system. We know that ovary is the main reproductive gland of female. Two such glands are situated on two sides of the uterus. In each month, generally, one ovum excretes from one ovary and moves towards the uterine cavity through the fallopian tube. Look here. The whole thing is the female reproductive system. This and this are ovaries. This and this are fallopian tubes, and this is the uterus. In each month, one ovum excretes from this ovary and moves along these fallopian tubes towards uterus, and on the next month this way. During that period, if sperms are present in the female genital organ and move towards fallopian tube, they surround the ovum there, and one of them penetrates the wall of the ovum to fertilize it. This fertilized ovum finally comes to uterine cavity to get plunged into the endometrium of the uterus, where it grows into a full-fledged baby. As discussed earlier, these two are ovaries. This is the fallopian tubes, and this is the uterus. Now, when the ovum is coming through fallopian tubes towards this uterus, if sperm happens to come here and moving towards this fallopian tubes, they meet, the sperms and the ovum meet here somewhere in the fallopian tube, and one of the sperms, or millions of sperms, one of the millions of sperms penetrate the ovum and fertilize it. Thus fertilized ovum now moves here in this way and get plunged in somewhere in this endometrium. This is called endometrium. This is endometrium, inner wall of the uterus. Somewhere in the uterus, and there it grows into a full-fledged baby within 9 months and 10 days. Mind it, not 10 months, 9 months and 10 days. Finally, the baby comes out this path, along this path. Generally, it comes along this path, unless it is done by any surgery, that is cesarean surgery. In that case, the baby doesn't come here. That is some different way it comes. What is PCOS? In PCOS, due to imbalance of hormones, multiple, about 12, cysts are formed in the ovary in place of one mature ovum. There occurs a surge of male androgen, and menstruation becomes irregular or stops. Together with appear a lot of unnatural signs and symptoms in the person of the woman. Collectively, it is called PCOS. Look on the left side. This is a normal ovary and this is a fallopian tube. We know in each month one mature ovum comes from this ovary towards this fallopian tube and it moves along the uterus. We know that. Now in case of polycystic ovarian diseases, what happens? This ovary, there is no single mature ovum, rather a lot of, maybe about 12, a lot of cyst, small cyst. Cyst means small bag-like swelling. Small multiple cyst comes here. There is no mature ovum. Multiple cysts comes here. For that thing, no ovum comes out of this fallopian tubes. So there will be no fertilization, no egg, no fertilization, and the person, I mean that the lady will be infertile, that is sterile. He will not have any child. This is cyst, and since the number of cysts is many, it is called polycystic. Poly means many, cystic means cyst, that is. So this is the pathology or rather trouble occur in polycystic ovarian diseases. Polycystic ovarian syndrome, polycystic ovarian syndrome. Polycystic ovarian disease is a separate thing. This is polycystic ovarian syndrome. What are the signs and symptoms of PCOS? Number 1, irregular menses or cessation of menses. Number 2, overweight of the baby. Number 3, body. Number 3, acne and unnatural hair appears on the face. Number 4, thinning of hair on the scalp. Now 5, pain in pelvis. 6, depression. 7, voice becomes heavy, rough like males. 8, skin hues become darker in places. 9, USG of ovary shows about 12 cysts like a garland. Very interesting thing. This is the USG. There are 12 cysts, the image of 12 cysts like a garland. This is the peculiar USG of PCOS. With this USG, this disease is diagnosed. Why PCOS occurs? No definite cause is known, but scientists think that the following may be responsible for the disorder. Number 1, genetic abnormality or familial traits. Number 2, insulin resistance and obesity. Number 3, erroneous food habits and lifestyle. It's mycotoxin from foods and low immune power. Medical think tanks think due to erroneous food habits and lack of physical movement, toxins enter in the body and cannot find route to go out of the system. They create a low continuous inflammation in the system. This spreads out in the body and is attracted preferably towards weakest organ of the body. Multiple cysts in uterus secrete more androgen, and absence of matured ovum lowers the production of female hormones. As such, higher androgen causes overweight, insulin resistance, thickening of voice, overgrowth of hair, and irregularity in menses. What complications may arise out of PCOS? Number 1, heart trouble. Number 2, brain stroke. Number 3, endometrial cancer. Number 4, sleep apnea. 5, diabetes. 6, high level of cholesterol and triglycerides. 7, high BP. 8, depression, anxiety. What are the treatments of PCOS? Modern medicine treats PCOS patients with oral contraceptive pills, patch, vaginal rings to regularize menstruation. It manages insulin problem with metmorphines. It fights out infertility with clomiphene. There are many physical and chemical procedures to weed out undesirable hairs and hair follicles from face and body. How to prevent and manage PCOS radically? From observation, it has been ascertained that PCOS is more due to errors in diets and unhealthy lifestyles than due to genes. If someone thinks that she would get cured by taking medicines only, she is mistaken seriously. Medicines may bring relief for some time, but would surely fail to give permanent cure in the long run. Following are the steps to achieve permanent prevention of the disease. Number 1. Please mind that packet foods of salty, high-fat, bottled, canned foods and drinks like fruit drinks, cold drinks, ice creams, chocolate contains a high level of toxin. Do not allow these to be taken regularly by your words. Number 2. Give them complete grains, not refined carbs, atta out of wheats, not flour, not white sugar but jaggery, not polished rice but ordinary rice, not salty chanachur but gums, nuts fried over hot sand, sun trans fat completely. Mind these foods of trans fat are very much deleterious, that is dangerous for the liver. On the right hand top side this has been shown toxic trans food with a red cross. These are full of toxins. Number 3. Give them daily eggs, milk, butter, fishes with fresh green veggies. Most of them are of vitamin A, full of vitamin A. 4. Give them fresh fruits with vitamin C and B complex adequately with staple foods as refreshments. These are so much effective in eradicating toxins from the system and supplying antioxidant to systems. For complete free from diseases, these are must. Okay. This is the food full of vitamin C. These are foods full of vitamin B complex, except this red meat. This is vitamin A, source of vitamin A. 5. From tender age, inspire them to practice physical exercises or dances or swimming or any other games or sports. Modern science says that no other thing can be more beneficial to young girls than this. Girls would get all-round benefits. They would never suffer from any depression or anxiety or worry. There won't be any problem of obesity, heart, lungs, kidneys, liver and organs of reproduction. Everything would be healthy. No problem of high BP, high blood sugar, high cholesterol, triglycerides would be there every day just for 30 minutes, but to be performed seriously so that perspiration comes out. With perspiration goes out toxins of the body. Practice them to take adequate water also. Now we will take up the issue of management, that is, if someone is already suffering from disease, how to tackle this problem. Medicinal requirement by gynecologists is a must to follow, and along with it, change of lifestyle and diets should also be adopted. No physician would object to it. Only medicine cannot give a sustainable benefit. It will give definite positive results for a particular period. With this, if proper diet and lifestyle changes are adopted, as described earlier, the same would prove highly efficacious for the patients, and every good physician knows and supports this. Unless otherwise forbidden, physical exercise and proper diets should be part and parcel of the management. Only medicine cannot achieve all-round benefits. Whenever required, medicine may be taken, but do not make it a practice of life, varying a few situations. Objectives should be to taper off medicine and manage normal life with proper diet and lifestyle. Too much dependence on medicine is sure to bring forth more trouble in later life.
Our presentation ends here. You have gone through the whole session. Now please Give your comments as to the quality of this presentation. How this could have been much better, what should have been added, or what should not have been added. I'll be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.